Yeah, the model is a measure of hospital capacity and preparedness, a metric once used in the very beginning to assess an area's response to the virus. And while the state has allowed Kern to move tiers, the model from back in June still holds. Businesses are back. After Kern kept its new cases of coronavirus and positivity rates low for 2 weeks, we moved tiers and businesses can start getting back to work, even though public health is still predicting a coronavirus peak after the first of the year.
Our modeling hasn't changed.
Kern Public Health released their first model predicting a February peak back in June. And while that still might be the case, what has changed are what's called the actuals. So the data is no longer trending right along with the line the model suggests.
Because of the interventions, social distancing being one of the main drivers of us not following that trajectory.
The modeling is used to anticipate and prepare the local healthcare system.
So the modeling is designed to work with our local hospitals and ensure that we've got the capacity to look at that worst case scenario so that we are prepared as a community to handle our sick individuals.
Something the county has said is a much better indicator of how well an area is responding to the virus, and a measurement that was used to measure progress in the very beginning of the pandemic. But nevertheless,
that modeling is in no way connected to the tiered system that has been set forth by the governor's office.
So while the state counts case numbers, the county considers hospital capacity for a February coronavirus peak that might actually be better than the model predicts.
And so we continue to be prepared as a community with our healthcare partners for that worst case scenario, but we know we can avoid it and keep the curve flat by the actions we take as a community.
Is there a story you think we should investigate? Call our Eyewitness News tip line at 869-2929.